I'm Dr. Elizabeth Hewitt. I'm a foot and ankle surgeon who practices in Columbus, Ohio. I work with Foot and Ankle Physicians of Ohio, and my practice is primarily rear foot reconstruction, but I like to say I do everything. So whether it's a hammer toe to an ankle replacement, I always say that we kind of handle a little bit of everything. What really led me to SEAL external fixators is really all the extra pieces. So I've been quite familiar with external fixation in my practice, and I've used many other systems, and I think I was just really blown away with the fact that their product is so intuitive to what the surgeon needs. So it's all the extra bells and whistles, I guess I like to call it. It makes putting the frame on much smoother, much easier, and I think that really translates into a benefit for the patients. So when it's easy to put that frame on the patient, there's less operating time, there's less tourniquet time, and I think that that really is a benefit to patients. But I think what was most impressive about SEAL is really their commitment to foot and ankle surgeons and continuing to educate the profession. As a foot and ankle surgeon, I am heavily active with our residency program and also have a fellow coming in next year. And a big piece of some of the products that I like to use is, who's really supporting our profession and continuing to further the growth of podiatry in our practice surgically. So, events like this mean everything to me as a surgeon, and I think it's really important that we continue to educate our youth. So having these residency trainings means so much for really progressing our profession. Even as somebody coming to help train, just by getting to intermingle with other people from different parts of the country, I always feel like I walk out of these events having learned something. There's always a different way of doing things, and that's, I think, kind of the beauty or the artistic approach that external fixation lends its surgeons. So unlike internal fixation, where sometimes there's a very rigid way of doing things, I am more predisposed to the mindset of many external fixation surgeons, just in that there's more of an art form to it and there's no wrong way. And that's also why I think it's so important that we have these events, and I'm so appreciative that SEAL continues to provide these events, not just for residents to kind of teach the basics, but also just for some of the guys that are more familiar with it, just so that we can kind of talk shop and we get to kind of pick each other's brains, and there might be a new way of doing something that you haven't thought of. And so it's always something that I look forward to personally, not just giving back, but also selfishly, so that I maybe can pick up a couple new tricks.